Hi, this is Christine Kraft with Maryville University for Nursing Assessment 612. I'm doing my head-to-toe assessment. This is Megan, my volunteer, who I will be doing my head-to-toe assessment with. She has emptied her bladder. She is wearing light clothing to do the assessment with. We have done the far vision test using the Snellen chart and the visual acuity. We have done her height and weight and vital signs, which are all within normal limits. I'm going to begin by inspecting her scalp and her hair. I'm going to make sure that it is all throughout. There is no signs of psoriasis or alopecia, no scatterness. I'm going to palpate her scalp to make sure that it is soft and round with no crepidus, no tenderness upon palpation. Her hair is soft and clean and evenly distributed. Her facial skin is clean, dry, intact, no lesions, no dryness. It is pink throughout. Her eyes are clear. Her conjunctiva is clear. Her sclera is white, no signs of jaundice. Her lashes are curled upright and evenly distributed. Her eyebrows are evenly distributed. Her eyes are in line with the ears. No signs of droopiness. I'm now going to assess for perla. I'm going to have it look straight ahead of me. I'm going to do direct, and now I'm doing consensual. I'll be doing the left for direct and consensual. I'm also going to be assessing for extraocular movements by following my pin light. Her cranial nerves 2, 3, and 6 are intact. She had consensual, no extraocular or nystagmus present. We're going to be doing the cover and uncover test. So maybe if you'll find a focus point on the wall there, go ahead and cover your right eye. There is no form of nystagmus and or lazy eye. Go ahead and uncover. Again, no extraocular movements with the opposite eye. Go ahead and cover your left eye. No presence of nystagmus and or extraocular movements at this time. Go ahead and uncover. And it remains the same. I'm going to go ahead and have you smile, stick out your tongue, puff out your cheeks, wrinkle your forehead, stick out your tongue, and wiggle back and forth. Cranial nerves 5 and 7 are intact. And at this point in time, then, I'm going to also assess and inspect her ears. Her ears and auricles are pink. They're warm. No signs of lesions or keloid. She does have piercings present. No external drainage noted. Her auricles free pain. Is there any tenderness upon palpation? I'm also at this time going to assess the temporomandibular joint. So if you would please open and close. Any tenderness? No tenderness or crepidus present. While I'm still in the facial and the head area, I'm going to assess the sinus. I'm going to assess the sinuses. I'm going to test the frontal, the maxillary, and the nasoseptal. There is no current swelling present. Was there any tenderness upon palpation? At this point in time, also at this time, I'm going to assess for cranial nerve factor 1, which is olfactory. I want you to close one nostril for me, if you would. And if you can inhale, what does that smell like to you? Alcohol. Okay. So she is able to smell the presence of the alcohol in the swab, so therefore cranial nerve 1 is intact. I'm going to go ahead and assess her eyes. We have already stated that the sclera and the conjunctiva is clear and white. There is no abrasions or drainage. I'm going to assess for the red reflex starting with the left eye. Megan, if you look straight ahead at me. At this point in time, I'm assessing the left eye and noting the red reflex. As I note the red reflex, I narrow then down in to assess the ocular nerve, or excuse me, the optical and the vasculature. Left eye is clear. All vasculature is clear, no narrowing. I'm going to now assess the red reflex in the right eye. Straight ahead, there you go. Red reflex is noted. At this point in time, I'm then going to narrow down into the ocular vasculature area. Noting the optic. Vasculature in the right eye is clear and no narrowing present. At this point in time, I'm going to assess the nasal area, which your septum is midline. And how you look up. At this point, there is no drainage. There is no septum deviation. I'm going to assess her turbinates. They should be pink and moist. Go ahead and look straight up. Turbinates are pink and clear. No lesions present. That's okay. I'm also going to then assess the mouth and the oral pharynx area. So if you would please be open, stick out your tongue. The tongue is pink and clear if you lift up. The bottom of the oral pharynx is pink, clean, intact. Teeth are present and intact. The hard and soft palate, at this point I'm going to assess the light, are pink. Tonsils are non-swollen. Actually, no tonsils present. At this point, I'm also going to assess the cranial nerve 9 and 10, which is the gag reflex. So Megan, do a stick out the tongue. Say and cranial nerve 9 and 10 are intact with the gag reflex. At this point, since I'm still in this region, I'm going to assess the cranial nerve 8. So I'm going to go ahead and step on to the left side of Megan. I'm going to whisper a word, and I want you to tell me what you hear. Apple. Perfect. I'm going to go to the right side and whisper a word. Computer. Cranial nerve 8 is intact. I'm going to take just one quick step back and assess for the sensitivity for touch on her forehead. So if you would close your eyes, I want you to tell me where you feel this Q-tip. Chin, forehead, left cheek. Perfect. So her sensitivity to touch on the cheek, chin, and forehead are present. I'm now, since I'm in this area, going to remain and assess the neck, at which point I see no JVD. I see the skin is intact, no lesions present. I'm going to come in and assess for the lymph nodes for the preocular, postocular, occipital, tonsillar, submandibular, submental, postcervical, cervical chain, supraclavicular, postclavicular. Go ahead, if you mind, at this point, just raise your arms lightly. I'm going to then assess the axillary lymph nodes, and none are swollen or any tenderness at that point. I'm also then going to assess the chest. I'm going to put my hand gently across. I'm going to see if I note any heaves, pulses. None are noted. Also, at this point in time, her chest and back ratio is a 2 to 1. She has equal chest raise. I'm going to go ahead and test cranial nerve 11. So if you please just let me know if you have any tenderness in your neck. Now you press against my right. Press forward. Press back. And your shoulder shrug. Perfect. Any tenderness there? No preface was noted and no tenderness. I'm going to go ahead and listen to our heart and lungs and assess that at this time. I'm going to start from the top and listen to each carotid as well as listen to our thyroid. At this point, you would take a deep breath and hold it and let it out. Deep breath in, hold it, and let it out. Just breathe normal and listen to the thyroid area. I will then pulse or palpate for the pulse. Pulses bilaterally of the carotids are palpable, 3+. There are no buoys present bilaterally at all, and the thyroid is also clear as far as any buoys. I'm going to continue to listen to the heart and lung sounds, starting at the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. Heart sounds are clear and distinct. There are no frictions and or rubs at this point in time. I'm going to gently place my hand down in the mitral area for any heaves or pulsations. None are noted. I'm going to go ahead at this point and inspect the chest area that I can visualize. Her skin on her chest is clear, it's pink, it's dry and intact, no abrasions, and is pink throughout. I'm going to go ahead at this time then and come to the back and listen to her lung sounds. Posterior lung sounds are clear to auscultation. I'm at this time going to test for any tactile primitus. If you would for me, if you would say 99, 99, 99, 99. There is no tactile primitus present, no extra pulses or vibrations noted during her in the lung fields, noting any dullness or resonance. At this point, I will go ahead and percuss while I'm in the back. There is no hyperresonance noted or dullness upon palpation and or tympanic. I'm going to do the cross-vertebral angle tenderness while I'm in the back. If you would, do you feel any tenderness? No. Any tenderness? No. Negative for tenderness in the cross-vertebral angle. At this time, I'm going to look at the anterior chest and go ahead and auscultate that at this point. Anterior lung sounds are clear throughout all lung fields and equal lateral raise of the lung fields. While I'm in this area, I will then go for the upper extremities. I'm going to have her on palpation and inspection. Her skin is pink, dry, intact, no abrasions, lacerations. Any tenderness? Radial pulses are 2+ and strong. Numbing or tingling present in the upper extremity. At this time then, if you wouldn't mind, I'm going to go ahead and have you, take a seat. While she is at this angle, I'm going to assess for any JVD presence. Currently, at the angle 45, there is no JVD present. I'm going to do another check, at which point I'm going to lower her. At which point for her, normal is slight JVD present and back up to 45 degrees. And we have no JVD present. I'm going to then just gently lift up the scrub top here. I'm going to assess her abdomen. Her abdomen is pink, dry, no abrasions, scars, lacerations. I'm going to auscultate all fields. While I'm auscultating in the abdomen area, I'm going to be looking to the aortic, to the renal arteries, I've been illuminated slightly so I can listen to the femoral arteries, which I'm just going to come through here, are lateral. Abdomen has positive vowel sounds in all four quadrants. The aortic artery, renal arteries, and the femoral arteries are negative for breweries. At this point in time, I'm going to do leg palpation. Any tenderness. I'm going to lower her a little flat so we can go ahead and find a liver border and a span border. At which point in time, if you would take a deep breath in for me and breathe it out. Any tenderness. And out. I'm sorry, deep breath in and deep breath out. Alright, splenic border is within normal limits as well as liver border. And I'm going to now go ahead and the tympanic throughout all abdominal areas. At this point in time, then, I'm going to look down her lower extremities. Her skin is pink, dry, and intact. I'm going to palpate for her pedal pulses. Her posterior tibial pulses. All are present in 2+. So if you would go ahead and push down with the gas pedal, push down with the gas pedal. If you would push against, push against. She has good strength in her lower extremities as well as good circulation. You know what, I'm going to take one more backtrack and we're going to do the lever incline test at this time. I'm going to bring you up just a little bit here. This is where I want to tap the tuning fork. I'm going to place it in the center of your head. And I need you to tell me if you hear it in one ear or both ears. Okay? And which, if it's one ear versus the other, which ear. Hear both ears or one ear? Perfect. So the lever has positive sign where she's heard it in both ears. At this point, we're going to do the right where we're going to note if her air conduction is greater than her bone conduction. I'm going to tap this again. The place is behind your ear. When you don't hear it anymore, please let me know. And then I want you to tell me when you don't hear it when I pull it next to your ear. When you don't hear it. At this point in time, I'm monitoring the time to know whether her bone conduction is greater than air conduction. Perfect. So at this time, air conduction is greater than bone conduction, which is within normal limits. Since we're in this relaxed position, I'm now going to test for the reflexes a little bit better. I'm going to start doing the brachial reflexes by starting with the right. Just go ahead and rest this here. Actually, I have to rest this one here. I'm going to place my arm in the brachial area nerve. I'm going to tap. Upon the tapping of the brachial reflex, you should have a slight minimal jerk movement. Again, do the left. And she has positive reflexes present. Let me go ahead and have you jiggle one more time for me. I'm going to do the knee tendon and the Achilles. So if you would look straight ahead. Actually, I'm going to do a trick with you. If you would please, just gently come across here. When I say pull, I want you to look straight ahead at the wall and pull your arms. Okay? Pull. Pull. She has reflexes present both in the knee tendon area. I'm now going to assess for the Achilles, which I'm going to have her just gently relax her leg in my hand. I'm going to tap on the back of the Achilles. And she should just have slight jerk movement in the foot behind her back. And she has slight jerk movement down and bilaterally Achilles. At this point in time, I do believe that concludes our head to toe assessment, and I thank you for watching.